Okay, good morning, and thank you for joining us today. I am Malika Gauthier from Pros, and in this webinar, we are going to discuss how to optimize pricing and sales strategies to tackle the current challenges that we see in the healthcare and in the medtech markets. So for this webinar, I am pleased to welcome today Gabor Tat from Spire Healthcare. Gabor is Gabor is a senior revenue manager at Spire, where he develops innovative and data-driven pricing models and strategies. And for the past 4 years, Gabor has been working closely internally to implement the Pros pricing solutions. So he's doing us the pleasure today to have this open discussion about their journey with Pros, to share some insights and some best practices along the way. And to feed this discussion and animate it, my colleague Reno Kapp here is a lead strategy consultant at Pros, and he will bring to this interview his industry knowledge and his strong expertise of successful pricing strategies. Reno has been working for 12 years at Pros, where he helps his customers from various sectors to optimize their sales efficiency and to increase margins through strategic and dynamic pricing. Just before we get started, a quick reminder that this session lasts 30 minutes and it includes a live Q&A at the end. So please feel free to drop your questions all throughout the session in the Q&A panel, and we will address them at the end. Okay, well, with that, gentlemen, the floor is yours. I will see you in a few minutes.
Thank you very much, Malika. Yeah, and I also want to welcome you from my side. As you know, this webinar today is one of a series of kind of activities. We focus around the healthcare and medtech market. We have published before 2 blogs. We are publishing emails and marketing material around this healthcare and medtech sector. And as you perhaps know, and you can find some of these customer logos on our webpage, we are very active in that space and have a lot of customers in that space, like reaching from GE Healthcare, guys like Smith & Nephew, B. Braun in Germany, and many others. And one of them we invited today is Spire Healthcare. And before I start the interview with Gabor, I want to set the scene a little bit and give you an introduction, because today in the healthcare industry, there is a lot of change. At least this is what we are noticing, but not only we, but also analysts like Deloitte, McKinsey, and others. So there's a huge trend towards digitization, and they also kind of invented this term XaaS, everything as a service, from like software as a service, everything as a service. And they say that this is the commandment of the hour. So what does it mean, right? Some of these challenges in the healthcare industry, they have been around for a long time, right? Some have accelerated through the pandemic and others are relatively new. So some of these companies could increase their revenues and margins during the crisis because they sold masks, special gloves, respiration devices, specialized equipment for fighting the COVID disease, right? And hospitals treated patients of the COVID pandemic, and they received obviously good funding for it. Others have lost turnover because of other medical treatments and operations were postponed due to capacity reasons. So now everyone is kind of back to normal, and now the kind of normal fight started again. Companies are striving for profitable growth again, right? But there are some very specific challenges out there in the healthcare industry, which I want to call out. It's a kind of varied mix of challenges and opportunities, really. And the key challenges here are, and obviously Gabor will also talk about this later on, is there is a quite of high barrier, to entry on both sides, on the healthcare, like, hospitals like Spire Healthcare, but also for the medtech, right? You cannot just enter that market, with a new device. To develop this new device, to innovate, takes years and years, right? And then typically if there is a new innovation from a smaller company, the big guys would buy that company, right? Also on the EU, I mean, we are here in European Union, right? At least Germany, Gabor, apologies, you're in the UK, but UK, also they have country regulations they need to adhere to. There is a huge cost pressure from the national healthcare, kind of authorities. If you think about the NHS in the UK, there's a lot of written today in the media about NHS and the healthcare system in the UK in general, but also in if you think about Germany now, there is a whole transformation going on of the hospitals, right? There are a lot of supply chain complexities, industry consolidation, purchasing power, GPOs, buying groups, etc. Just to mention a few. So while there are these challenges today, there is, of course, always opportunity. And we also want to talk about opportunities. We have an aging population in Europe, right? People are getting older, many clinical and non-clinical unmet needs to address. Think about long COVID, for example. The demand for data-driven efficiency, so the healthcare is not different than other industries. So the challenges really are in MedTech and healthcare in a pretty similar way, I think. They only sit on different sides of the tables when negotiating the contract, right? And today, of course, we would like to focus on one side of the table, on the healthcare sector, and have invited Gabor Todd from Spire Healthcare to talk about their challenges and how they use the Pro solution. And interestingly, as I mentioned, Spire is not a medtech company, but operating hospitals in the UK and offering operations and treatment to their patients. So Gabor and Spire, they're actually sitting on the other side of the table when medtech companies are selling their products or selling their services to guys like Spire. However, we want to talk about the specific challenges of Spire and how their business has, adapted throughout the recent years. And the first topic, Gabor, we wanted to talk about is I mentioned that the healthcare industry needs to navigate all the regulatory changes. There's a lot of digital transformation going on. The market conditions are changing. There's a lot of competitive pressure in the market. So, Gabor, does Spire Healthcare face similar challenges which I mentioned, and do you think that the market conditions have changed in the healthcare sector?
Yes, we definitely can see very similar challenges at Spire Healthcare and in our hospitals in particular. One of the major change what actually we can see is that now patients' requirements are to have access to fast care, and this is something in our hospitals we can continue to meet actually this demand with high quality diagnosis and also with the treatment what we provide to patients in our hospitals. One of the other thing what we can see from these challenges is the different services actually what now the market requires and what people actually are looking for, and not necessarily just in a hospital setting, also out of hospital settings. So for example, in smaller clinics or in communities as well.
All right. Yeah, understand. And how would eventually, Spire, how did you react in the past to these changes?
Yes, so at Spire, our number one priority is always the quality of care and the patient safety, whilst also driving efficiencies, generating profit, and then margin improvements. To these challenges, actually, we have a program of investment in digital platforms to transfer our business. As you mentioned also before, that digital transformation is now particularly important in the healthcare sector as well. So this allows us actually to drive further change for improvement, not just for patients, but also for colleagues, and generate, significant efficiencies. So in our case, one of these digital platform and in pricing in particular was the implementation of the pricing engine, which is basically from two different parts. One is the CPQ, so the smart CPQ, and then the price management solution as well. So in our case, again, with the pricing engine, we took control actually of the prices across all our hospitals, which also allowed to meet the regulatory controls and also the guidelines related to pricing.
All right. Yeah, that sounds logical. I mean, I mentioned the pandemics and COVID, and yeah, I don't want to get hung up on this. The people don't want to hear about this anymore. But a lot of our clients, they talk about an increasing cost pressure in the market, and that this cost pressure is kind of persistent even after the pandemic. Is that also something you observe?
Yes, definitely. I think actually the cost pressure is always
It's always there, right?
It's
Yeah,
always
yeah.
there, right? But probably after COVID, it became more of a focus, and even for us now, we have various initiatives, to try to improve cost efficiencies across the business, but in particular in hospitals.
All right. Yeah, I know you are located in the UK, and Spire Healthcare is specifically operating in the UK, and there are all these specific challenges also with NHS and the entire health system in the
Yes.
UK. But do you think that a lot of those challenges are also similar when you compare it, with other European countries or even globally?
Yes, I think so. The COVID-19 pandemic had a big impact on the public, healthcare systems across the world. Creating postponed elective procedures, creating backlogs. So definitely it had a big impact on.
All right. Okay. Yeah, I think we don't only want to talk about the challenges, but also new approaches, innovations, and how you go about coding and pricing. Yeah, I also would like to talk about kind of new go-to-market approaches in healthcare. I mentioned specific in MedTech, they are constantly looking for new ways of selling their products, like subscriptions, bundling with services, etc., etc. So, we kind of constantly hear this from suppliers and manufacturers about these new ways of quoting and pricing. So you as Spire Healthcare, you sit on the other side of the table. Do you also kind of adopt new ways of quoting, new ways of pricing your healthcare services to patients?
Yes, but first for us, actually, what was very important and the biggest change in terms of pricing, and quoting is to centralize and digitalize all these processes. So that was for us the first step, because prior, having a pricing solution, the prices, for all procedures were kept in spreadsheets, in post-it notes around the hospitals. And also quotes, were given to patients, sometimes even verbally. So now this with the pricing engine and the pricing solutions in particular, now we can make sure that we manage all the prices centrally. We can make changes quickly if necessary, and then we can also ensure that hospitals are using up-to-date prices, so the latest prices, what the central pricing team set across the group. And in terms of the CPQ, is very good because it provides a branded quote letter to our patient, which also then considered as a contract, and it tells the patient what exactly they need to pay before actually they want to go ahead. They confirm that yes, we would like to go ahead with this service.
Okay. Maybe as a benefit to the people here on the call and the audience, I guess you need to explain perhaps a little bit how you do the business, that you kind of offer an operation, you offer treatment to your patients, because
Sure.
I guess for a lot of German people, this sounds like very awkward, unless you have a private insurance and you can really say, okay, I want to have, let's say, this knee operation, not in 2 months, but I want this knee operation this week, and I'm ready to pay another extra 10 grand to have this knee operation this week. I think this is kind of your business model, right?
Yes, I mean, we have three areas in our business. So the NHS, which you mentioned earlier, the National Health System, the private medical insurance, where people have an insurance and then they can use that whenever they need it. Or there is the self-pay part, which actually we are responsible for. I'm myself included. That's where patients, they can just come see a surgeon. They have an appointment, and if the surgeon says, let's say I need a hip replacement, for example, then we create a quote using the pricing engine. And then if the patient accepts that, then as soon as there is a treatment slot available, they can have the procedures almost immediately.
Oh, okay, understand. All right. And how many hospitals do you operate, Spire Healthcare, if I may
We have
ask?
38 hospitals across the UK.
38. All right.
Correct.
Thank you. Yeah, that was very insightful, I guess, specifically for our audience here on the call. Obviously, we also want to talk about the pricing and the CPQ solution. And I think I would be interested in, number one, why was Spire Healthcare actually looking into, introducing a pricing and CPQ solution, and why specifically pros? Why did you select pros?
Sure. So as I mentioned previously, that we have various programs at the moment, to digitize, to transform the business, to move more towards a digital solutions, in various areas of the company. And in pricing, the primary goal, what we had, is to take control for this self-pay inpatient and day case prices from our hospitals and manage these prices centrally. So that was actually the main driver to select the pricing engine and the pricing solution.
Okay. And can you share some insights specifically on pros? Why? I mean, I know very often this is kind of treated as a secret, but maybe you have some insights why I selected pros.
No, absolutely. So we started actually the vendor selection with an external, with a management consultant company, because to be frank, we not necessarily had at that point the necessary knowledge, to select the right pricing solution for us. And then during this vendor selection process, we obviously came across pros. And when we made the selection, actually pros ticked several boxes for us. So one of them was the compatibility with SAP. So we have SAP as a CRM system. So that was actually very important. The other important point was that PROS was able to handle very specific healthcare needs for us. So as I explained it previously, the healthcare process, the quoting process is very complex, but PROS managed this for us very, very well. And also, which actually became valuable during the implementation, and we get to know this one a little bit later, is the culture fit was very, very important for us as well with PROS.
All right. Thanks a lot for those insights and sharing this with us and the audience, Gabor. Maybe one or two add-on questions to the same topic here. How long did it take you to finalize your evaluation until you started the project? And did you need, I mean, you mentioned the consulting company, right?
Correct.
So you was looking for advice, right?
Yes.
So you used some external help for this evaluation, right?
Absolutely. So we started the RFP process in February 2020, and by July actually we made the selection. So it took a few months, but by July we selected PROS, and the management consultant company was actually with us since appointing them for the RFP process, all the way through until actually to go live, in various touch points during the project.
All right. Okay. And what was the kind of time when you selected a vendor and then started the project and then went live?
As soon as we selected pros, the project pretty much started. So it was very, very quick in that sense. And we went live with all of our hospitals within a year. So we started with few pilot hospitals at the beginning to make sure that the solution is fit for purpose. We also listened to feedback, from end users. We made changes. We ironed out a few challenges here and there. And then as soon as the pilot hospitals were successful, we started to roll out in batches of hospitals around 8-10 at a time, and which took, if each batch of hospital probably took around 3 months. And then within a year, the CPQ solution was available in every single hospital.
Very nice. Yeah. And this is a nice segue into our next topics, the achieved results. What's kind of the outcome of utilizing a pricing and CPQ solution. And obviously you cannot share any specific figures with us, but maybe from our experience, what we see in the market, this really very much depends on the solution, right, which our customers are using. And obviously the highest impact can really be achieved from leveraging our price guidance. But there is, of course, a difference whether you only use CPQ or you use CPQ and the pricing solution. And then on top, maybe you use price optimization driven by artificial intelligence. And there are, of course, different opinions about that. There are a lot of independent analysts like Gartner, Forrester, and others. They talk about a revenue uplift of 1 to 5% and margin improvements of 2 and 10%. But this is very high level, right? And not really talking about the underlying solution. We also did an own study as pros amongst 131 customers, and we came up, with like efficiency gains, specifically when you talk about CPQ of up to 67%. This is what our customers reported back to us. So which means that you are more than double faster to get out a quote to your clients. And if you talk about price optimization, they report a 1 to 3% revenue increase. And you could translate this into margin increase if you assume the same cost base. So there is obviously a lot to gain. And I also wanted to ask you, Gabor, how long kind of did it take until you saw the first results? And maybe, I know you cannot share numbers, but maybe there are some results you can share.
Yes. So unfortunately, yes, we cannot share specific numbers, but very interesting, and even for us, actually, that was a surprise. That in our pricing engine business case, we anticipated that the return on investment will be a few years, actually. But what we have seen after go live, that the return on investment was met within 6 months. Which is extremely quick, and then it's as I said, it's exceeded all our expectations.
Wow, this is quite good ROI. We typically tell our customers that they can have a payback within 12 months, so an ROI within 12 months. But 6 months is very good. Is a very good result.
Yes. We were also very surprised, pleasantly surprised.
But that includes CPQ and pricing, right?
Yes, correct.
Okay. All right.
Yes.
Very interesting. Thank you. I guess before we get to the Q&A, we also wanted to talk about, as a last topic, about best practices. So, kind of what ways, approaches, strategies did you apply to be successful in pricing and CPQ, or in general, in the healthcare sector. So, what I can share, and I shared this already during the introduction partially, is clearly we see a trend to subscriptions, so that the MedTech companies, they are not selling the capital equipment to guys like you, but leasing them, financing them, or you just have a subscription or pay per use. So that you as the hospital, you pay for a blood test, you pay for an MRT scan, these kind of things, but you're not buying an MRT device for 10 million, right? That's the kind of new trend. Also, what we see is the kind of creating packages of instruments and services. So in the case you mentioned knee operation, it's a perfect example. We have a brand new customer. They are selling all the instruments and services around a spine or a knee operation. So you just order the package and you get all the instruments, the kind of bandages, and all the stuff you need to conduct an operation. And then of course there are additional services like renting out loan kits to hospitals or keeping consignment stocks and all that good stuff. So in terms of these more strategic approach, what do you think are the best practices and are the success factors to make Spire successful?
Yeah, so in our case, the success of implementing the pros pricing solution is definitely, so one was the communication with the various stakeholders in our business. It's hospitals or even executives. So it was a big change to move from almost an analog pricing to a completely digital way of quoting and pricing for our patients. The scalability of the solution was also one of the key factor for us to have this project as a success. And lastly is the speed of the price changes, the price change implementation, what we can do. That's also very important in our case.
Okay. So those would be kind of, if you think that the three, if you will, the three most important success factors to the success
Correct.
of Spire Healthcare. All
Correct.
right. Yeah, I think that's a perfect summary and a nice kind of end to our interview and discussion. Thank you very much, Gabor, for being
It's
with
my
us
pleasure.
today and spending the time. And I want to open up, the floor to the audience. If there are any questions in the questions box or the chat box. Malika, did we receive any questions?
Yes, I do have a question, and we have 2 minutes, so let's look at that one. So for you, Gabor, how has the implementation of those solutions impacted patient satisfaction and overall service delivery at Spire Healthcare?
Yes, so it definitely improved the patient satisfaction in terms of, as I mentioned earlier, that now we have a branded, very similar quote letter for every single patient when we create a quote. So it's not the same for everyone. Is everything there detailed? What they are actually paying for, what their package is, if you will. And also this obviously having the CPQ system, it's improved efficiency. We can create quotes much quicker to patients. As soon as we receive an inquiry, the hospitals can create a quote within minutes and then can send it to the patient.
Yes, that's an impressive change indeed. Okay, let me have a look. Right, one last question. This one will be more for you, Reno. What are some common challenges that healthcare providers face when implementing CPQ and pricing solutions, and how do we address those challenges at PROS?
Yeah, I think some of these challenges we discussed already, but I think a lot of these, both on MedTech and healthcare, they want to move to a more digital sales process, right? Where they use a CRM, they use a CPQ to create a quote. So it's no longer in Excel or stickers or anything. So everything is documented. You can use in CPQ, specifically on the MedTech side, our configurator to configure very large, complex, capital products. So if you think about an MRT device, so you can overcome these challenges of, configuring a device. You can kind of bundle things together with services. You can create bundles. You can offer subscriptions. You can offer pay-per-use. So these new challenges they have with, supporting these new go-to-market models, we can perfectly support with our pricing and quoting solution, because they can offer subscriptions. They can offer pay-per-use and all of these new or not so new models, I have to say. And on the pricing side, also a lot of them now, if you think about Hologic or other customers, they use our price optimization, and they so they really generate very promising results with that.
Okay. Well, thank you both. We are at time, so I will set you free. But thanks again for sharing those insights. Thanks a lot to you, Gabor, and thanks, Reno, and thanks for everyone for attending. Yes, and have a good day. Okay.
Thank you.
Thank
Bye-bye.
you. Bye.
Thank you. Bye.